tell me your name and your birthday?
Sally Sunshine, July 1st, 91.
Okay, well, I got your name and your birthday. Now I've got the right person. Can you tell me where you are?
I'm at GWU Nursing School.
Okay, and why did you come in today?
I just want to get a full body physical.
Okay, well, we're going to start with your head, your eyes, your ears, your nose, and your throat. Can you go ahead and sit up here on the bed for me, please?
Sure.
Alright, well, the first thing I'm going to do is just take a good look at your scalp and your hair. Let me know if you feel any pain or tenderness.
No.
Have you had any change in your hair, any hair loss?
No.
Okay. I see that's growing nice and evenly, good texture, taking good care of yourself. I'm just going to palpate your face here. Let me know if you feel any tenderness.
No.
Have you felt any changes in your skin?
No, not lately.
Any oiliness or dryness?
My skin's naturally oily, but that's my natural.
Okay, alright. Alright, Sally, what I'm going to have you do is I'm going to have you make some faces at me. I know it might seem silly, but that's part of how we can see if your facial nerves are working okay. So I want you to make the same face I make, okay? That's good. Can you smile? Good smile. Can you frown? That's very good. And one more thing. I'm just going to feel your jaw. I want you to clench your teeth. Alright, and I want you to move your jaw up and down. Alright, good. You don't seem to be having any pain there, are you?
No.
Alright, well the next thing I'm going to do is I'm going to check your hearing. Have you noticed any loss?
What's that?
You're silly. Can you, I think you hear me pretty well, but have you noticed any changes?
No, I have not.
Okay, right. So Sally, I'm going to check your hearing. What I want you to do is when I put this on the top of your head, I want you to tell me where you hear the sound.
Okay.
You might hear it more on the right or the left, or you may hear it in both ears.
Okay. I hear them both ears.
Okay, wonderful. We're going to do another hearing test. We're going to put it behind your ear on your mastoid process. That lets us know if the sound works through bone. Now you can hear through that process. You can also hear from the air like you normally do. So we're going to start with your mastoid process first, and when you don't hear it, tell me when you don't hear it, okay?
Okay, I don't hear it anymore. Okay, I don't hear it anymore.
Okay, and your air conduction was longer than your bone conduction, which is what we want to see.
Okay.
We're going to do it with the other ear. I'm going to try to get it right on the first time.
I don't hear it anymore. I don't hear it anymore.
Okay, good. Now we're going to do another hearing test. This is a whisper test.
Okay.
So what I want you to do is I want you to cover up your other ear, cover this ear, and I'm going to whisper something over here,
Okay.
and I want you to tell me what you hear, okay?
Okay. Little.
Okay, now do it with the other ear.
Mermaid.
Little Mermaid, you got it, good. All right, Sally, so I'm going to check your ears now. Have you had any pain in your ears?
No.
I'm checking the little middle part of your ear called the tragus. Is it tender there?
No.
Is the outer part the pinna tender?
No.
Okay, have you noticed any ringing in your ears?
No.
Okay, well what I'm going to do now is I'm going to look inside your ear, into the inner ear canal, and I'm going to hold on to your ear and sort of push against your head. So I want you to be really still so that this doesn't go too far, alright?
Okay.
And again, if anything hurts you, let me know, okay?
Okay.
Alright. Well, I'm noticing that you have a nice, clear tympanic membrane. See the hair in there, a little bit of wax. I'm seeing the normal landmarks, the umbo, the cone of light. And I'm also seeing that you're free of scars, so that looks really good in there.
Okay.
We're going to take a look into the other side now. Again, I'm just going to pull your ear up. Another nice clear eardrum, free of scar, to see the cone of light and all those normal landmarks. Good ear health, wonderful. Alright, Sally, now I'm going to take a better look at your nose. If you wouldn't mind, could you take your glasses off for me?
Sure.
Alright, well I've changed the end of my otoscope here So what I'm going to do is I'm going to use it to look up your nose. But first, I'm just going to palpate your nose. Have you ever broken your nose or had any injury there?
No, I haven't.
Is this any of this stiff or ouchy?
No.
Okay. You can open your eyes now. I'm going to look up your nose if you don't mind. If you wouldn't mind tilting your head a little bit. I've got my little pen light here. Just looking for any septal deviations, any polyps. Alright. And this always feels a little silly to me, but I'm just going to use this to look inside your nose.
Okay.
You can tilt your head back. And I want you to be real still, okay?
Mm-hmm.
To turn the light on first. Alright, and I'm looking up in here, and I'm not seeing any polyps or any septal deviation on the left or on the right. Good, nice, clear, no inflammation. Your turbinates look good, wonderful. Now that I've looked at the structure of your nose, I'm going to do a couple of nose tests.
Okay.
First, what I want you to do is I want you to put one finger on one nostril. I want you to breathe, sniff in for me. All right, is that okay for you?
Mm-hmm.
You breathe normally on that side all the time?
Mm-hmm.
All right, can you do it for the other side? Wonderful. Now that we know that both of the sides are patent, that air's going through, we're going to do a little smell test.
Okay.
So I've got some things I want you to smell, but I'm going to have you close your eyes,
Ooh.
and you're going to do the same thing where you cover one nostril and smell for me.
Okay. 7.
Okay. I've got another thing for you to smell. Can you cover the other nostril for me now?
Alcohol.
All right. I'm glad that you're smelling those. Those are pretty distinctive smells. All right, Sally. Now we're going to do the eye chart. And now I see you have glasses, so you've probably done this many times before. So just to review, I'm going to have you hold it about 14 inches from your body. And you're going to read it first with your right eye while covering your left. And then you'll switch and you'll read it the other direction. So this time I want you to read left to right.
Okay.
Smallest line.
426 739. Left E, upward E, downwards E, OOX.
Very good. Now I want you to switch hands. And this time you're going to read right to left.
Okay. XOO, downwards E, upwards E, left E. 9 3 7 6 2 4.
Wonderful. Okay, now both together.
426 739. Left E, up E, downwards E, OOX.
Wonderful. You've got 20/20 vision with your glasses on. Now we're going to do some more tests. These are more to test your field of vision and watch how your eyes move. So what I want you to do, I want you to follow my pen, okay? All right, and I want you to just keep following it, all right?
Would you like me to take off my glasses?
You can leave them on or take them off. Either way is fine. So just follow my pen. All right, good. Now I want you to follow the pen. And then feel your eyes cross. That's what they want them to do. That's wonderful. Good. I'm glad we got that right. All right, so now we're going to do our field of vision test, to test your peripheral vision. Now, it might be a little silly. I'm going to use some bunny fingers, and I want you to cover the same eye as I'm covering, and I want you to look straight at me.
Okay.
So when you see my fingers come into view, say, I see your fingers.
Okay.
Okay?
I see your fingers.
Okay?
I see your fingers. I see your fingers.
Okay. Now, I told you it was a little silly. We're going to do it again from this side.
I see them.
Okay.
I see them.
Good.
I see them.
Wonderful. We've got those eye tests down. Now we're going to do some more eye tests, but we're going to dim the lights a little bit. Oh, wait, we have one more light on test. We're going to do one that tests to see if you've got something called strabismus, which is kind of like a lazy eye. So what I want you to do is I want you to look far over my left shoulder. All right? And I'm just going to cover and uncover your eye to see if there's any movement when I move the card back. Okay? Left eye's good. Right eye's good too. Wonderful. Now we've got our eye test that we're going to use the lights dimmed for, okay?
Okay.
All right, Sally. Now check your pupils. I want to make sure that your pupils constrict and dilate with light at the same time. So I'm just going to shine this over. You've got dark eyes, so it's nice to see that they're constricting at the same rate. Good. I'm going to check my chart here. Your pupils are about 4 millimeters, which is good. Now I'm going to do another test. I want to see that they reflect the same in your pupils. And they do. I see the reflection in both eyes. So on my chart I write that your pupils are equal and reactive to light. So that's really good. Alright, Sally, now that I've checked your eyes with my pen light, I've seen that your pupils are reacting the way they should, and I saw the red reflection like I should. But I know that you see your ophthalmologist for your yearly eye exam, so that would be a good time for him to check your retinas and make sure that things are going well inside your eyes.
Okay.
Sally, I've just put my gloves on, so now we're going to do the mouth exam.
Okay.
I see that the skin of your lips is nice and intact. You don't have any sores or any cracks. That's really good. Now I need you to open your mouth for me nice and wide. And I want you to tilt your head back for me. Alright, I see no sores in the top. And I'm just going to look and see back at your tonsils for me, okay? Alright, just got a gag reflex too. Alright. The next thing I'm going to do is I'm just going to switch hands here because I'm right-handed. And I'm just going to take a little peek around your mouth, okay? Open real wide for me. Alright. There's nothing, no sores around her tongue. Her cheeks look good. And none of her teeth are loose. That's good. Alright. Wonderful. Now the next thing we're going to do is a little tongue motion, okay? This sounds weird, but I want you to push my finger with your tongue. Alright? The other side. Good. Alright, Sally, now we've done some of the mouth exercises to see that you're okay. I need to look under your tongue. So what I'm going to do is stick your tongue out. I'm just going to pinch your tongue with this, and I'm going to look under your tongue with my light.
Okay.
I know, it feels like you're at the dentist, but you're not. Alright, I don't see any sores there. Alright, oops. Alright, that doesn't always happen, but sometimes it does because the gauze is dry. Now, if you will just kind of open wide for me, I'm just going to look inside. Don't see any sores. Good. Good. Alright. Now we're going to do our thyroid exam. Let me take my gloves off, okay? Alright, Sally, the last part of our exam is the thyroid exam. Have you noticed any changes in feeling warm or cold?
No.
Have you had any changes in your weight?
Just a little bit.
You gained weight or lost some?
Gain.
Okay, well, sometimes your thyroid has an effect on your metabolism, so what I'm going to do is sit here on the edge of the table, and I'm just going to feel your neck.
Okay.
And I'm going to stand behind you so that I can really feel where it is. And I'm also going to have you swallow, just so I know where your esophagus is.
Okay.
Alright, so I'm going to go ahead and scoot there. It's kind of hard to move on paper, isn't it? Alright, I'm just going to sit behind you a little bit.
Okay.
Alright. And I'm palpating your neck. What I want you to do is I want you to swallow for me. Alright, well I don't feel good. I don't feel any lumps or any nodules, and I don't feel that it's enlarged. Is anything tender there?
No.
Okay. I'm going to also palpate your lymph nodes. There are a lot of them all over your body. Let me turn this way for me. And they're kind of like the infection fighters. So I'm just going to be feeling around your face, your preauricular, your postauricular. Let me know if you feel any tenderness. Alright. Any here? Okay. Alright, now I want you to shrug your shoulders for me. Good. Alright, well I don't feel any hardened or swollen lymph nodes there above your clavicle. That's wonderful. You seem to be doing really well today. I hope you keep on doing well. And you're taking care of yourself, okay?
Thank you.
Alright, thank you. Have a good day.